When was the last time that you reviewed your access logs in your healthcare practice? My name is Jean Eaton, your practice management mentor with Information Managers. And in this Practice Management Nugget webinar, we will look at how to improve your healthcare practice security with audit logs. In our policies and procedures, we indicate the reasonable safeguards that we expect to implement in our practices. But policies and good intentions alone isn't enough. We also need to take action on our policies. We have tools like audit logs available to us. Now we need to use them to ensure that safeguards are in place to protect health information, our people, and our assets. Audit logs of our computer and software systems are available to provide a tracking of users who have accessed the system and the information contained in the systems. Now, the question is, how are you actually using those audit logs? Now, the audit log is a technology piece that's happened in your computer systems and in your EMR software. So that audit log records every time the user logs into the system. So first thing in the morning, you enter your username and password to log into the computer system, and then you might log into the EMR system that you're using as well. So you'll have an audit log for your computer network and an audit log for your EMR system. Each of those transactions are recorded in the computer system. And depending on which software system that you have, it will record less or more details. Ideally, it will record the name, date, and time of the user that's logged in, where they've logged in from, and what systems did they access. So did they access the EMR? Did they print? Did they go to the fax server? Did they save, delete, or change or create a document? All of those transactions will be recorded in a file that monitors all of those transactions. So it's a transaction log or an audit log. Now, those audit logs are very important to be able to record who did what when. So one of the things that an audit log will help you to do is to take a look at those instances that are outside of the norm. So if your clinic operates from 8 a.m. to 5 p.m., and you review your audit logs. Now, there's a lot of information in the audit logs. So you want to look at the things that are easiest to access. So if your clinic closes at 5 o'clock and you review the audit log and you see that somebody's been logging in at 7 o'clock, at 8 o'clock, and 9 o'clock in the evening, well, that should certainly raise red flags for you. And you should be taking a look at that in more detail to find out who is accessing the information. Is it an authorized user who's using it for an unauthorized purpose? Somebody who's gone home for the day and accessed the information remotely because they were bored and they wanted to do some snooping? Or was it somebody who has authorized use and they are using it for an authorized purpose? Perhaps the billing person is doing the reconciliation reports from home. That might be okay and appropriate for your organization. But until you see what's happening in the audit logs, you won't know who's doing what when. Now, you might also find that there are people accessing your computer network that are not authorized and they're getting through your firewall. Or perhaps they're trying to get to the firewall and your firewall is actually doing a good job and preventing those people to access your system. So once you start looking at audit logs, you will find that there are many people that are trying to attack your computer system. And this is common, unfortunately. Every time you start taking a look at your audit logs, you'll see that your antivirus and anti-malware software system is doing a good job in preventing threats and bots and attacks into your system. That's something that you want to know as well, that these safeguards that you've put in place are actually working. So the commissioner's office has asked this particular person about how are you actually implementing and using your audit logs. So we've talked about a few examples. Snooping, or viewing someone's health information for an unauthorized use, is unfortunately far too common circumstance in healthcare. Snooping is always a breach of confidentiality and trust that our patients give to us. Sometimes snooping is because someone is concerned or curious about a family member or friend, and they don't intend to do anything bad with that information. We also know that people will sometimes access information for malicious means. That is, they're using the information for a criminal intent or to be mean or disparaging to the patients involved. When you regularly review your audit logs, you create a deterrent to all users who might otherwise be inclined to check something out just this once. No one will know. Regular review of your audit logs will also help you to find potential threats or weaknesses in your current systems that can be improved. Custodians have an obligation to ensure reasonable safeguards are implemented. This includes having policies and procedures and to be able to demonstrate and document that you are taking reasonable safeguards. One way to do this is having a regular privacy and security monthly audit. To help you, I'm pleased to announce that this new template is now available to members of Practice Management Success. Let's take a few minutes to introduce you to the Privacy and Security Monthly Audit templates. Implementing a privacy and security monthly audit supports your privacy and security policies, procedures, and training. Regular audits improves the security to employees and patients by reducing the likelihood of information theft. It protects your people and your assets from external threats, sanctions, and even fines and jail time. Regular audits also demonstrate compliance to privacy and security best practices. When you download and use the Privacy and Security Monthly Audit template, you will be able to include your team in everyday actionable steps that contribute to privacy and security. You will be able to conduct regular, routine risk assessments quickly and easily. The templates will guide you in discussions together with your team to get their feedback, input, and customize a procedure that you can use in your practice to train your team and monitor for success. Start your audit program by prioritizing your safeguards. You want to identify which type of safeguards in your practice are going to be easily monitored and audited that is going to give you the best success. Review the risk assessments, the privacy impact assessment, or policies and procedures for safeguards that you have previously identified that you will implement. Select one or two examples of appropriate safeguards each month to audit. These might be items that are easy to implement but are important to your practice. Maybe they're the foundational elements in your privacy and security practices. For example, we may have a goal or a safeguard in place that each user will have a unique user ID and password. So that's a safeguard item in your policies and procedures. Let's identify a goal about what behavior will be demonstrated when you implement that safeguard. For example, computer users will ensure that their workstations are accessed only by the person who logged into the workstation. This ensures that personal information is accessed only by persons who are authorized to view the information. Users will not share their computer login credentials, their login name and password with anyone else. Each user will have a unique computer login name and password. There will be no group or shared accounts. When the user leaves the workstation, the user will lock or log out of the workstation so that a username and password prompt is required to resume the session. You will identify what policies and procedures that you already have in your practice that relates to this particular goal or an audit. After all, it doesn't make any sense to audit for compliance for a policy that you don't have in place. So we want to be able to make sure there's a clear cross-reference between what you said you were going to do and what the expectation is and what you actually observed as being happening. For this example, observe each of the computer workstations in the clinic. Record the number of computer workstations observed during the audit. How many were in compliance to the goal? What will you observe? So let's take a look at what that report might look like. In this example, a supervisor, a manager, or privacy officer, and one of the frontline persons in your clinic will walk through the clinic to observe how you are meeting your goals. And then you record your observations in the form. So in this example, you're going to take a look at all of the workstations in the clinic. So you've counted them up and you know that you've got a total of 16. As you walk through the clinic space, you observe which people are using the computers and how they're being used. You identify that there are 10 active users. And for each user, you would go to the workstation and observe over their shoulder. You tell them that you're doing the audit and make sure that the correct user is using the correct workstation. So in many cases, the user's name is available on the screen display in the lower left-hand corner of the computer. So if Jean is logged into that computer, then it should be Jean who's actually using the computer. So in this example, we identified that there were 10 active users and 9 of them were being used correctly and 1 was not. So it may have been Sally's name that appears on the screen, but it was Jean that was actually using the computer. So obviously that is an error of some kind, and you'll need to identify what the source of the error was. That leaves 6 workstations in the clinic that were unattended. Of those workstations, 4 of them were either logged out or locked. So that means when I go to that empty workstation and I jiggle the mouse or I enter something on the keyboard, I can't get into the computer system. It requires me to log in a username and a password before I can go any further. 4 of those 6 workstations were properly logged out or locked out, but 2 of them were still open. So those 2 become a problem that you need to identify what the source of the problem is. In your audit, you're going to record your observations, and then you are going to identify what the recommendations are. So perhaps there is a training issue. Somebody left the workstation only intended to go across the room for pick up something from the printer, but got called away, but didn't come back to log out of the workstation. Or perhaps you've got a new staff member in place, and that new staff member doesn't have a new user login and password, so one of the existing staff has shared their account with a new person so that they can get on with their day. So you need to identify what is not correct and identify what the problem is, and then make the appropriate recommendations. Is it a training issue? Is there a change that's required for workflow or the process? Identify your action items. What do you recommend that you start, stop, or keep doing? Identify when you will review this again. And then, of course, share the results with your team. The audit report and recommendations are reviewed by the privacy officer and the custodians of the clinic. So there, you've done your first audit for that first month. Now you need to wash, rinse, and repeat each month. You are on your way to improving privacy and security in your practice. Let me know how these privacy and security monthly audit templates help you in your practice. If you like this episode, please subscribe to this channel and add your honest feedback to the comments below. When you leave your review, it helps people who like what you like to find this podcast. Until next time, this is Jean Eaton, your practice management mentor with Information Managers.